Good afternoon. I'm at Navin Hospital and I'm joined by Dr. R B Saxena, who is consultant general and laparoscopic surgeon at Navin Hospital. He is vastly experienced in all kind of laparoscopic surgery and also has a hand-on experience in doing cancer surgery. His special interest is laparoscopic surgeries like lap poly, hernia, and above that he also operates upon the breast cancer patients. Prior to joining Navin Hospitals, he has been working with Medanta Hospital as consultant laparoscopic surgeon. Let me welcome Dr. Saxena. Welcome, Dr. Saxena. So you have now joined Navin Hospital as senior consultant general in laparoscopic surgery. So this is quite different from what you have been experiencing at Medanta. Medanta is a hospital where you get all rich class people generally. Of course, there is the category of middle class people who come for surgery as well. But if we talk about Navin Hospital, Greater Noida, then it's more of middle, lower and upper middle class. That is the segment that comes to Navin Hospital as of now. So how is the experience different from treating patients over there and at Navin Hospital?
Yeah, there is a great difference between treating the patient here and in Medanta. Basically in Medanta, all the rich community belongs to Medanta basically, and they have a full knowledge about what they are being, what the disease is and what the procedure is going on. In Navin Hospital, we are trying to first counsel the patient what the disease is and how we treat the patient and how we are going to proceed in that.
Basically makes bond between doctor and patient much stronger when you are talking to the patient before the surgery. So you are trying to tell him about what is the problem that he's facing, what is the problems he'll face in future if he's not operated upon, what would be the operation cost, how he would be operated, what will the total stay. So this is more of a transparent procedure that you follow rather than at Medanta where the patient comes and he's ready for being operated.
Yeah, obviously.
So facilities are same. You use similar laparoscope, everything same. Now with the hospital being revamped, good beds, AC rooms. So don't you think that for general surgery, people should prefer to go for a secondary care hospital rather than tertiary care hospital? Because tertiary care hospitals are mainly for super specialists, like if you're going for a neurosurgery or a cardiac surgery or maybe a cancer surgery, that too high-end cancer surgery, then going to tertiary hospital is feasible. Because even TPS say, if I'm talking about TPA, third party administrators, they say for general surgery, if you are making a package of say 40,000 rupees for a lap poly, then that means that we would prefer if you go to a secondary care hospital. Because so don't you think that the people should go for a secondary care hospital rather than going to a tertiary care hospital?
Yeah, surely. That's why I'm here basically, just to provide the facilities what they are giving in the tertiary hospital and what I learn in that particular hospital. I'm trying to give that comfort and that support to the patient here in the Navin Hospital.
So what kind of surgeries are we doing over here at Navin Hospitals?
We are doing all the general laparoscopic surgeries. We are doing cancer surgery like breast cancers,
okay.
and along with that all the basic surgical.
So all appendectomy,
all appendixectomy, gallstone surgeries, all the laparoscopic surgeries.
So since Greater Noida is very much means the expressway is prone to accidents and all, so you must be getting quite a few patients for abdominal trauma surgeries.
Yeah.
So how do you handle those kind of patients?
Yeah, this is a very challenging job to handle a case of abdominal trauma in here basically in this particular region, because the patient usually comes in shock and we have to manage the shock first. And immediately we have to shift the patient in OT, and we got injury like liver injuries, we got a splenic trauma here, and we have very less time because we have to save the life of the patient as well as we have to control the bleeding in the same time of.
Breast cancer is one cancer that people say is most curable cancer if detected in time.
Yeah.
Because it's a more of a localized cancer, right? So what kind of patients you generally get for breast cancer? This being basically surrounded by villages and people who are not very much aware about the breast cancer as to how to detect a breast cancer and all. So do you counsel the patients who come for suppose a mother comes who is having a breast lump and it turns out to be a cancer on mammography scan or ultrasound scan, and she has a daughter who is like 20-21 years age. So you must be having some counseling sessions with those people, to tell them that okay, your mother is having a breast cancer history. So something of that program are you?
Yeah, we have a fixed protocol regarding this breast cancer. So we follow these protocols accordingly, and we counsel the patient. We counsel the patient's attendant, son, child, or her husband. We counsel each and every candidate of the family about the disease and things, and accordingly we also explain the outcome of the treatment.
We came to know that you are also well versed in treating the renal tumors. What are renal tumors, and means what is the treatment plan for them?
Yeah, renal tumor, basically this is nowadays the patients usually present with hematuria, and sometimes a lump in the abdomen and sometimes the pain in abdomen. When the patient present, the tumor already become so big that it becomes challenging for us to handle that tumor. But whenever we are going for screening for some other disease or some pain, and we found that there is some mass in the kidney, we are taking that mass as a cancer until 2 other ones. We are going to do some other investigation.
So what is the investigation that we do for diagnosis of spinal?
The best investigation is the CT urography, in which we can get a contrast enhancing mass in the kidney. So, and the age of the patient, we consider all of the things, and accordingly we decide.
Okay, so the line of treatment is diagnosis of the first CT urography, followed by a surgery.
It depends whether the tumor is localized or it is spread to other part as well.
Okay, if it has spread, then
if it is spread to if it is localized up to IVC, it can be removable. But if it is spread to the other systems like lungs and other part of the body, then the chemotherapy will be primarily treated.
okay. What is the average length of stay at Navin Hospital for laparoscopic surgeries like gall bladder stone surgery and all?
Basically, in our hospital, we used to keep patient for 1 year.
1 year.
Yeah.
Okay.
And for small procedure, like we used to do congenital hernia as well. So we take the patient for 1 year.
Congenital hernia as well. Okay, so that for that, how much time you keep it?
We keep the patient for 24 hours.
24 hours.
Next day early morning, we discharge the patient.
Okay. Thank you so much, Dr. Saxena, for talking to us. It was very, very, very nice talking to you. Thank you so much.
Thank you.